Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, and of course with our Chief Infectious Disease guy here, Dana Hawkinson, the Medical Director of Infection Prevention and Control. Hawkeye, Doc Hawk, whatever else I call him on any given day.
Yeah.
Welcome back.
Thanks. I just slept all day.
Oh, yeah, that's what I heard.
Yeah.
That's because you never sleep, right?
All right.
All right.
So.
Hey, not good today.
No. The numbers have just continued to tick up, unfortunately. I mean, I would like to go back to 36 in-house with active infections. Unfortunately, right now, 53 with active infections, 17 of those in the ICU, 8 on the ventilator. We still have 26 in that recovery period. That's better, so hopefully people are getting out of the hospital. But that's still a lot of total patients. And in Hayes, they do have a lot as well. Their numbers have gone up. 22 patients, 19 active infections, and the others are recovering as well. So unfortunately, the numbers are trending in the wrong direction.
So this is clearly a big wave or surge that we're experiencing. I think related to maybe some frustrations around having to continue to follow all the rules of infection control, as well as people being home, schools open. Although schools look less of a factor, it looks more related to maybe after-school activities, but really folks congregating and are the big. That is really the thing. Whether it's in a bar, a restaurant, your neighborhood, a party, indoors, outdoors, it's just become a bigger issue. In fact, today, the chief medical officers here in Kansas City are going to be briefing our metro area elected officials and public health officials about our concerns around capacity and where we see in the curve. There will be a news conference that follows. So media, you might want to, if you ever able, you should have gotten an invitation to that. That'll start at 10:20. And then for our guests, our listeners today, watch the things later tonight. I'm sure there will be a lot of news coverage about some of this because we are getting more concerned about our bed capacity and about what's going on in the city around the dynamic of this infection. So some disturbing trends. We'll visit about that more. First of all, with that, let's just see if there are media questions that are out there right now.
Hey, good morning. Cody with Channel 9. How are you today?
Hey, good, Cody. How are you?
Hey, Cody.
I'm doing all right. You touched on it a little bit, and if you could, you don't have to spill all the beans on the announcement later this morning, but just your overall thoughts on where we're standing right now. Obviously, we had snow last week, but we've had this nice warm stretch where people are maybe outside more, not as tightly packed indoors as they would be. Does that seem to help or hinder anything right now?
Good questions, Cody. We are concerned. There's no question about that. That'll be the real thrust of the news conference today, and y'all will hear that. We've got a lot of numbers pulled together for that. And so we'll be kind of getting into that discussion. I do think that the warm weather of people getting outside will hopefully help a little. I get concerned when it gets colder. We are concerned about the impact of that. And as you pointed out last week or whatever, it had snowed, and I'm sure that forced more people indoors, and people maybe had gathered more indoors or in restaurants or wherever it may be, and that probably changed behaviors, and that may be part of the reason we're seeing this rapid rise now. But the numbers in Kansas City continue to rise on a daily basis, and the total number of hospitalized COVID patients in Kansas City are rising on a daily basis right now. We're up 10% versus yesterday, and that was up 10% from the day before. So, I think we're at a period where we really need people to get back to flattening the curve, and we know how to do that. We've done it before. Our message will be, let's do it again.
Yeah. And I think more important to that, you bring up a good point about the weather. That's just been a few days. Just as we've seen with the other holidays since the spring and after the opening, it's not that particular day or that weekend, and it's not a few days where it's warm where people can be outside. It's the infections 2 and 3 layers down the road, whether that's what happened in Sturgis, whether that's what happened at Lake of the Ozarks over the holidays, or whether that happened, at a wedding that was discussed and published about in Maine. It's those infection layers 2 to 3 infection cycles down the road. And I mean, unfortunately, even though we had the warm weather, we know a lot of people had get-togethers over the Halloween weekend. And so that has caused infections. Now we need to look 2 and 3 infection cycles, which is basically 4 to 6 weeks down the road to
it's
see
going to
the
hit
true
right on top of
impact.
Thanksgiving is when we're going to start seeing that, and then we'll see the effect of Thanksgiving around Christmas, and Christmas will be around middle to late January. And so we're going to see, we have a series of events that we've really got to just got to encourage people about how real this is. And I think there's a whole lot of COVID weariness. And I've got it. Everybody's got to have it, and I think that it's going to guide behaviors, unfortunately. But we got to try and get back to bending the curve.
COVID weariness with seasonal affective disorder and lack of sunlight.
Well, let's see, it's cow sad. I don't know. It's a cow sad.
Sad cow.
Sad cow. Okay. Other questions?
Sad cow disease. All right.
Yeah, there you go.
A tridemic with influenza.
Okay, people.
All right, let's move on.
Next question. Any other questions out there?
Hey guys, good morning. This is Taylor, Channel 41.
Hey, Taylor.
Hi, Taylor.
Question about if you could update us on the recommendations right now for people to get tested as we move into flu season and cold season, that kind of thing. Situations where you can have some of the symptoms and you go and you fill out the questionnaire on some of the doctors' websites, and they say they don't necessarily suggest, but because you're not showing all the symptoms, what is the best practice right now for people who have some of the symptoms and think whether or not they should get tested if they haven't been exposed as far as they know to someone with COVID?
You bet. And that has changed throughout the pandemic because now we have a lot more testing available. And initially, we didn't have enough tests. And so you really wanted you to be tested if you're symptomatic and not. Don't get tested if you weren't. And we had to save a lot of the tests for hospitalizations and procedures and things like that. But right now, as of today, we don't really lack for testing capacity. And actually, the total number of tests being done has gone down a little bit. In part, we're concerned about that because we think people don't want to quarantine. So they don't want to go get tested because that means they have to quarantine until they get the result. They're worried about a positive result because they'd have to quarantine or miss work. And that's exactly the opposite of what we need to be people doing, Hawk. So really, we kind of liberalize those testing.
Yeah, as far as testing goes, certainly it's recommended that anybody who's a contact of a case get tested. We just don't exactly know when. We would try to land in that 5 to 8 day after your exposure. But you still have to remain in quarantine. Even if it's a negative test, you have to remain in quarantine. Now, when do you get tested if you're exhibiting symptoms? Well, the nice thing is if everybody can go to either the local health department or the CDC.gov, they have an excellent data set now of influenza activity in the United States. And the week ending last week, there were more than 11,000 tests performed at clinical laboratories around the nation, and there were only a handful of positive influenza tests even out of that 11,000. So there's extremely low influenza activity right now. So if you are exhibiting symptoms, you really definitely need to go get tested. In addition, we know that there are other cough and cold viruses going around. We know that in the summer and spring there were, just as there normally are. Unfortunately, with COVID, we really have to be more vigilant in getting the tests so that we can get ourselves isolated and have the other contacts of us known that we are a COVID patient now and that they should isolate or quarantine and go get tested. So it will be important moving forward, but I can tell you right now that around the nation, there's extremely low influenza activity. So if there are symptoms, the best bet is to call your local provider, call the health system, call your other physicians or public health labs to go get tested for COVID.
Other questions? Okay. So we have a couple of cool guests. I want to show you something. I got this delivered to me a few weeks ago. This is cool. You often feel like you're blessed in your life for one reason or another, and I think I'm kind of blessed on a daily basis, and I get to work in a great job, a great place, a great family, and a great wife, and just, I'm very blessed. And then I got this, and it's a blessing. This is Safe at City Market by Jill Ballou and the art by Corey Wright. And it's a children's book about how to stay safe. And it focuses on City Market, but the reality is the story could be about anywhere. And it's a diverse book, and it's a thoughtful, heartfelt book, and it's a wonderful story. And we're very lucky today to have two people who know this book really well. One is its author, Jill Ballou, and the second is Sue Patterson, the Director of Marketing and Communications at City Market. So, guys, tell us a little bit about this. First, Jill, how did you get this idea? And then, Sue, how did this go and be about City Market? How do we spawn? How do we get here? This is pretty cool stuff. So, Jill, tell me about the book. Tell our audience about the book. I've read the book.
Kendall and Sam are the two boys in the book, and they have visited the city market before in my first book, City Market. And so I wanted to bring them back in some way, and that was time for them to go back and visit the city market, some new shops, and to ride the streetcar. So the pandemic and the situation that we're in provided that perfect opportunity to bring the boys back and to empower them to show adults the role model that everybody needs to be.
And it's great. And just as I say, too, with Kendall and Sam at a time where there's been, some strife with race and Black Lives Matter and things of that nature that are so important, to have a diverse book like this also sends a great message, I think. So, Sue, talk a little bit about that and things. How are things at City Market?
Well, City Market is great. We've been here for more than 160 years, but this year has been quite unique. We are the most diverse place in Kansas City. I mean, we've got great people watching. You can eat your way around the world here. It's really an interesting treasure for Kansas City. I especially like, so Jill actually did the original City Market with Kendall and Sam. And then it's a popular one that you can pick up around the market as well. And then this second one, I love the covers because this cover is 5th and Walnut, our iconic sign. And then the new one features our brand new renovation. So if you haven't been to City Market in a while, you got to come see our iconic sign at 3rd and Walnut. So it's kind of new meets old. Our back door is no longer a back door. It's a through street, two-way on Walnut now. So, if you haven't been here in a while, you'll probably recall it's a little bit of a mousetrap when you drive in and try to figure it out. That's all gone, and now we're a through street, and there's more pedestrian wiggle room and better parking access and better visual, line of sight to the stores and so forth. So City Market's changed. You got to come see it. We're open year round too.
Yeah, it is. It's a Kansas City icon. Jill, did you have a follow-up there? I saw you start to look.
Well, yes, of course I do. Yeah, I love the City Market, which is why I wrote the first book. And it is a place where cultural diversity is celebrated with international flair, as Sue mentioned. And it's outside. So for this pandemic time that we're in, you can enjoy City Market outside and take your food outside to eat and enjoy the fresh air and have fun, which is exactly what Kendall and Sam do. They're just guys who want to have fun, but they want to do it safely, and they are very cognizant of protecting those around them. So that was the point of the book.
And it's cool. I kind of like that. Guys just want to have fun. That wasn't the original word. Sorry. When I've been to City Market, I've always found it a delightful place to be. It is so diverse, and it's just fun. But today, if you want to go down there, what are the hours? When is it, maybe less crowded if you want to go down there and you don't want to be around as many people?
City Market is a really great alternative to, the supermarket or to big box shopping. A lot of people think of City Market as produce, fruits and vegetables, that sort of thing, which we do. We have a lot of specialty grocers, import grocers, produce stands 7 days a week, and then, of course, the farmers market on the weekends. So, yes, if you're looking for your ingredients, a lot of people are cooking at home right now, we're definitely a great destination. And we are, open air. We have lots of social distancing protocol going on. But we also have a lot of retail. So, boutiques and interesting like game shops, things like that. So we're also a retail destination. And the really important distinction here, and I'll get into hours because that's always tricky down here, but a really important thing to point out is that we are open year round. We are all local. So we're all local all year. It's really important now more than ever, and I think we kind of learned this lesson early on in the pandemic, to support your local economy. We got to keep that local, food supply, food chain, and local food system going. And so when you come down and support City Market by directly purchasing from growers, like farmers at the farmers market, or say you buy a meal at a restaurant or shop in any of our shops, you are directly and indirectly supporting our local economy. And that is more important than ever. Our main focus here and mission is to provide access to fresh, healthy food for everyone in the community. And there's a lot of food insecurity going on right now because of employment challenges and all kinds of things that this pandemic has, well, that already existed, but boy, has it amplified. So this is a great place to come, feel safe, shop in areas where, we're not having the numbers that we usually have. And, people think of City Market as big crowds in the summer. Our pedestrian numbers are down. People are, though, using us as a destination. So it's less of a, sightseeing trip, although it's really entertaining. And I don't know what I'd do without the market right now. I'd be losing it because it's either home or work. And so it's a really nice, refreshing place to come, have a stroll. Face coverings are required on property, even in our outdoor areas. And in the pavilions, we've set up our vendors so that they're only on one side now. There's lots of passing, walking room, and we have directional signage. We are open 7 days a week. The farmers market is on Saturdays and Sundays from 9 to 3. But the stores and the restaurants and everything else have their own individual hours, and they're open almost every day. Sometimes Mondays tend to be their day off. Again, these are small family-owned businesses, so they got to take a day off once in a while.
Well, and the key is that I think having support for people who are supporting us as essential workers and frontline workers throughout a pandemic that don't really get to stop working, and they can't really shelter that well, and so it's really good to support them. Jill, let's move on to some of our questions. We know we have a lot from readers today. Let's get at it.
Right, and before we get to that, just one real quick question on topic. Donna has a program called Double Up Food Bucks, and she works with the City Market. She wants to know, where can she get the book?
The book is available here down at City Market. Is that right, Jill?
It is. It is available at City Market Coffee, the Coffee House, and at Bloom Bakery, and at the Candy Wizard. Those 3 vendors have it. So, great. And you can also order from Amazon.
Cool.
All right. So first question, what is the difference between licensed and staffed beds, and why does that matter?
Yeah, so that's a great question, and we're going to be exploring that more later today. Licensed beds are the number of beds that you have that you could put a patient in, and you have to go get that, and it's a number that you have to have approved by regulatory authorities, and you say, okay, so I have a hospital, I've got 1,000 beds, and I have 1,000 physical beds, but really I'm not used any of those for a long time, and so I only have 800 licensed beds. So I have 1,000 physical beds or 1,000 physical spaces for beds. I have 800 of those may be licensed, so I don't even have those other ones that even get a license. But then it's what number of that is staffed, and because there's a staffing shortage in general in healthcare, and more specifically during a pandemic, and especially when people have to work at home or their kids are at home, then let's say you start out with 1,000 physical beds, but you only have 800 licensed beds, you may only have 600 or 500 staffed beds. What we really have to look at is the number of staffed beds, because that's where you can actually put a patient, because you have somebody to take care of the patient. Your only other choice then is to try and change your staffing ratios and say, well, instead of a 4-to-1 staffing ratio for the nurse on the floor with patients, now I got to go to 5 or 6 or 8-to-1. And when you do that, care declines. And so then you have this battle between, okay, I can't offer as good a care because I have too many patients and I'm going to burn out, versus I can go ahead and try and take care of the patients and offer the best care. So those are the battles we face every day, and it's just gotten a lot tighter right now in the pandemic when 10% of hospitalized patients in the city are COVID-related.
All right, next question. When will the FDA issue emergency use authorizations, or EUAs, for monoclonal antibodies, and who will get these therapeutics first?
Yeah, that's a great question. Just to say, we actually got our form we had to complete to say we are capable of administering monoclonal antibodies. We signed that off yesterday. And so we are getting information about that rolling out from the FDA now. That's a big step. That's telling you that they must think they're getting close, Hawk.
Yeah, and especially for the outpatient, because that's really what this is. We know that those studies for inpatients, so when you come into the hospital, you're an inpatient, those studies were stopped because they didn't seem to be of benefit. So it is that outpatient. And we've actually been working for 5 or 6 weeks now on our systems here at the health system and our protocols to be able to do that. So the EUA will come out when the FDA thinks that there is enough information that it is valuable and beneficial and safe.
And I think that we would suggest that I think that that's going to be out sometime in the next 6 to 8 weeks, and maybe potentially sooner. There was an interim analysis published in the New England Journal of Medicine. Now, first of all, the New England Journal of Medicine never publishes an interim analysis because that's very unusual to do that. They really wait for the final study to be completed so they can show final results. And they did it on phase 2, not phase 3. Yeah. So what they're really saying to us is, hey, look, we're hoping this is working. You're in the middle of a pandemic. Here's some information so you can start thinking about how you want to do this. And what it showed on the interim analysis, and this is published, I think, October 28th, I was looking at a couple days ago, was that the hospitalization rate with this monoclonal antibody, I believe it was the one from Eli Lilly, dropped from 6.5% down to 1.4%, thereabouts. That's a pretty significant decline. If that's real, that's really impactful. Now, it's an interim analysis. It's early. It's preliminary data. We don't really need to know. I mean, we don't really know yet. It's phase 2. But we expect that the company, which is in phase 3 trials, is going to push their information over to the FDA sometime relatively soon, and then that will get an early use authorization, and that's why they're coming to us. And so we will be a distribution site. What we think is that patients will be eligible for this drug based on, first of all, their age, their weight, because we know that people who are more overweight have a harder time surviving this, and a few other what we call comorbid conditions. I was looking at the data last night. That's where the first wave of therapy will be directed, and that's because those are the folks who don't do very well with the disease. And then as more drug becomes available, I think those restrictions will probably loosen. So, I think hospitals will be the ones who get these medications first for distribution to the sickest of the sick.
And just a word of caution, we have to look to see what the recommendations will be. Again, this is probably a bimodal disease, that initial viral infection disease, and then later on, after 7, 10, 12, 14 days, you have that inflammatory state, and that's when you really get ill. So a lot of it will also matter on when you started having symptoms, because will there be a lot of benefit after a week of symptoms? We just don't know that. So a lot of it's going to be what are the recommendations. Certainly, President Trump was, benefited from that, probably because it was very early in the course within that first 2 to 3 days of symptoms. So a lot of that will matter on when you have symptoms and when you get tested.
Yeah, I think our data said you had to have it within the first 7 to 10 days, and I think earlier is better. And then the second thing we learned, and I just said something, I didn't say it correctly, it's not the sickest of the sick, that would be the hospitalized patients, but those who are at most risk for becoming the sickest of the sick, and so you get it as an outpatient. There are ongoing studies on whether or not this works inpatient. The preliminary data on that did not look as encouraging. You had to get it early, not later. And I think because of the points you made, later it's really inflammation. Early on is viral load, and what this drug is to do is addresses viral load. Okay.
All right. A lot of people today and all this week have wanted to know, what do you see as the factors causing the big spike in COVID-19 patient numbers? Today, people are saying, is it the schools?
Yeah, so that's a great question. And I think, actually, I love that term, sad cows. I'm going to steal that now, just so you know. I think that was Cody or Taylor who came up with it, and it's mine now. Seasonal affective disorder coupled with COVID weariness syndrome, sad cows. That's good. Yeah. I think people are tired of masking. I think they're tired of trying to behave, and plus, folks who have seen younger people not get sick, and they're young, say, I can go out and do this because I'm not going to get sick. Yeah. The problem is, to your earlier point, Hawk, it's that next generation. Yeah. They give it to their parents. The parents give it to the next set of their parents, and pretty soon you get older people, and then it's in nursing homes, and then the wave is really it's affecting all of us. I think the data that I'm seeing coming out of schools, in fact, I got a note from Children's Mercy yesterday, because they track this pretty closely. They work so hard with schools and reopening and keeping schools safe. It's not the schools.
No.
It's not this school that, now, there may be sports activities or group activities where kids getting together afterwards that help spread the virus, but it's not the actual school day itself.
Yeah, absolutely. The schools have been really good in trying to do everything they can within their school engineering, within the rooms, de-densifying, having masks, keeping all the adults in that school from doing the wrong things, not wearing their mask properly, not eating together, things of that nature. The school physical building and being in that building really has not shown to be the issue. It's what happens outside of the school, and it is that extracurricular stuff. It's families getting together for get-togethers or parties and things of that nature where we see a lot of the spread. It's still having more and more of the businesses open where people are going in and just taking off their mask and staying there for a long time and not understanding you can have your mask off when you're eating or drinking, but the rest of the time you can still spread. So it's a combination of those things. I would say further down on that list is the actual physical school where kids are getting into school.
So it's spreading. There's widespread community transmission now,
Yeah.
and that makes it harder to even do contact tracing because there are so many people that are positive, and you come in, and people that you don't know or you may not suspect. Because remember, up to 40% of these patients are asymptomatic. Some data just came out of Iceland this last week that looked at the percentage of patients who were positive much later in their, and they found I think about 40% of patients never had a PCR, and yet were carrying higher titers of some of the antibodies and the immunity to it. So, the point being that if you're not symptomatic, you could easily be transmitting it. And I think as you get wider spread community transmission, which is where we are, then what that means is that it's more likely you're going to come into contact with it. And so when you go into a bar, you go into a restaurant, you go into a shop, or you get together with a group of people who but you're intersecting different bubbles, your risks go up. And when the community transmission rate was lower before, you had a little less risk when you did that. But now that there's a higher community transmission rate, your risk is higher because of that, and it tends to spread a lot more. And that's the nature of this disease. And so we're at a very delicate time.
Yeah, absolutely.
Are we seeing any positive cases that can be related to Halloween gatherings yet?
What do you think, Hawk? Probably we could see some early ones, but it'd still be a little early.
No, I know that there are. I've had contact with people who have had get-togethers or been to get-togethers, and it's absolutely happening. And it's the children, because they don't get as sick, and maybe they may be asymptomatic, but it's also the adults too. So it has absolutely happened. That this just goes back to what we answered in this question beforehand. It's those points, but then it's also now 2 and 3 infections after this. And are you able to isolate and quarantine, or are you out when you're really, really infectious and you don't know it yet because you're asymptomatic and nobody else in the household has been diagnosed? And so spread happens that way. So absolutely we are. Anecdotally, Halloween was just a week ago, so we don't know the full extent of that. But that's just one more synergistic thing to add on to the spread that we already know is happening.
Yeah, and I think that's really our struggle, is that that asymptomatic spread is going to get us, and you got to go out and do it outside activities like City Market.
What is your biggest fear heading into Thanksgiving?
Oh man, it's group gatherings and people then not having masks off, and they're going to have to be inside because it's going to get chillier. If you can't eat outside, that's great, but I think it's going to be tough. And I actually, I think Thanksgiving and Christmas will be 2 of our most challenging days. Because the pull of family is just real, and friends, you want to be together. I want to be together with everybody. As I've said on this program before, we usually have 25 to 35 people at the house for Thanksgiving. We have a couple of our families that come together. We have some friends that come over and some strays who don't have places to go, and that just feels so good. And my wife does a great job. She puts everything, cooks food, and does it. Everybody brings some food over. I mean, it's a hoot. But this year's going to be different. And I think what we have to find is grace and hope in the difference. That you can still be with people. It may not be the same, but it can still be good. And if we keep each other safe, then come next Thanksgiving, man, I think it's going to open up a lot. But we have to find grace and hope in our ability to gather and be closest to some of those we love the most. While maybe not what it has been, it helps us set it up for what it can be. Yeah. Other thoughts on your standpoint on Thanksgiving?
we need to look forward because, right now the present and this environment, it's dangerous with the get-togethers and the gatherings.
What happens when hospitals run out of beds and/or staff?
Yeah, that's a scary thing, right? That's what you're seeing in El Paso right now. It's what you saw in New York earlier in the year, Houston, Miami, San Francisco, Seattle, other places that have had really significant surges. We don't want to be that. And what happens is you start having to send patients to other towns who may still have beds. The problem is the Midwest, the Southwest, Southeast, we're kind of in I hate to say the word crisis, but we got some big concerns, and we'll go to crisis the day we have to start sending people away. But I think we're there. I think we're at a really tight spot right now. We really have to work at bending the curve. We have to be KC. We started saying that months ago on this program. You have to be KC. I mean, I'm from Kansas City. I grew up here. Spent most of my life here. This is my town, and I think that it's our town. And we have to do what we can to take care of each other and to bend the curve. Because if you're a loved one or yourself and you're sick and there's no beds and you have to go to another city, let's say you got shipped up to Minneapolis, well, then you're not around anybody. And that's just really hard. And the way we keep each other safe is to do and follow the rules of infection control because they work. Remember what we've said so many times on this program. Where's the hottest zone, the hottest spot in any city in the country or in the world? Where is it? It's right here in the hospital, right? It's right here where all our COVID patients are because we group all those patients together. But when you look at all that grouping, you look at all those patients we've taken care of, how many of our staff have gotten sick because they took care of a COVID patient? We think the answer is virtually none. It may be zero. Our staff get sick because they go out in the community, or maybe they're even here and they take their mask off and they eat lunch together. It's not because they're taking care of COVID patients. And why is that? Why is it? Because they have to follow the rules of infection control. And putting a mask on works. And the proof is right here. It's at every hospital. And for anybody who doesn't believe it's true, I don't know how to help you. Because the proof is right here. And if you don't believe it's true, you're just wrong. And you're putting the world at risk. It's just not worth it. You can be safe, you can bend the curve, you follow the rules of infection control, and recognize that hope is on the horizon in the form of monoclonal antibody therapy, vaccination, and new antiretroviral or antiviral drug therapy, which is around the corner. I mean, again, I was reading about that in the last week. There's some really good things out there that are coming along that I think will help. So there is hope. We just got to get through it.
Who has the most power to make a difference in this pandemic right now?
No, there's no question. There's absolutely no question about this, is there? You do.
You.
There's just no question. Man, all you got to do is wear a mask and follow the rules. If you do that, you can keep us safe, huh?
Yeah. It's not monoclonal antibodies and air filtration devices. It's you and behavior. Behavior is more helpful and preventative than anything. And that behavior is wearing the mask, being distanced, not gathering in large groups, doing the right things. It's absolutely about individual behavior, and it has been. But obviously, the message continues to get out to new people every day, which is good. We want to keep getting that education, that message out. But it's individual behavior more than anything, more than blood type or other genetics. It's individual behavior, and that goes on a daily basis.
You know, I sound a little bit like I'm in church today or preachy, so I'm going to do it again. Here's the deal. There's no question that it's you. But there's two yous here. There's you on a daily basis, and there's you who trust science to help get us better. It's funny how science has somehow fallen into this state where people don't want to believe it as much. But if you think about it, science has developed antibiotics. Science has led to cures for cancer. That didn't happen by chance. That happened because somebody asked questions and they work together to discover new concepts and new ideas, new treatments that have led to the cure of so many diseases. You have a heart attack now? Okay, well, let's take care of that. You're going to hear on Monday about breast cancer, and we're going to talk a little bit about what delay in care means, because it looks like it did 10 or 20 years ago. Science is real. Science can help us, and science will help us get out of this pandemic. But until we have that answer, you have the answer. Jill.
All right, we have time for 2 more questions this morning because we have a busy, busy morning. And everybody, fantastic questions. I promise they're going to be on Monday. I'll bring them. All right, last 2 questions. I have jury duty next week. Is it safe for me to go? I don't personally, but that's the person who wrote the question.
Got the question. I read it.
Right. Yeah. I don't know. I'm sure in these governmental buildings, really in any business or anything, I would assume that they would probably be trying to do the spacing.
Yeah.
The masking is probably going to be mandatory. So I think if those protocols are put in place, I think it would be safe. And I'm not sure exactly, what county or what city that the jury duty's in, but I would hope that there would be infection prevention protocols put in place to make it as safe as possible. In addition to the mask, please bring a face shield or eye protection as well.
Yeah, I think that's exactly right. Everything I've heard is that they've done a good job at the county and city level about making courtrooms safer. So.
And last question for today. How do doctors feel about the restaurants that are putting up outdoor tents with heaters for winter? Is that safe?
Yeah. It's outdoors, but it's still now outdoors that's enclosed in a tent. I'm not really sure how safe that is. Some still have some open sides where maybe it is kind of, you have outdoor environment because you still have turbulent airflow. But I think if you are moving into a tent, it's still an enclosed space. And I wouldn't know or understand what the airflow and the air turnover in that
I don't know
thing
what that is.
I don't
Depends
think
on
it's
the
too
sides
much,
are open or if they're not open. I mean, if the sides are down and you're walking into a tent, well, that's not outdoors. That doesn't count. You got a roof and you got the sides down. The sides are open. There's heaters. That's better, especially with a little wind blowing.
Yeah.
I think that's better. But you just have, again, if there's a large gathering of people inside the tent, you can still get sick because you're going to be forced into being by each other, and that's still a problem. Being outside is helpful, but really it's the spacing as well as the breeze
and I would
things.
doubt that there's a lot of airflow and movement in there, especially in the winter where you're trying to keep it heated.
Yeah, I think if the flaps are down in the tent, it doesn't really count as being outside. Then you're inside. So, okay. Thank you all for listening to us today. I want to say a special thank you to our author of the book, Jill Ballou, Safe at City Market. I recommend it again. It's the best. And I want to say thanks a lot to Sue Patterson, the Director of Marketing and Communications at City Market. So,
there is one question for them. They want to know, are there gift cards?
Okay, I'll ask, guys, are there gift cards? Well, first of all, thank you. Any final thoughts? And are there gift cards for your book? Jill, let's start with you. Oh, Sue. Okay, Sue, go.
There are gift cards available at several of at most of our restaurants and retailers. And you could go to our website to find out who those are. That's the City Market, kc.org. I wanted to let you guys know you'll like this whole thing. We are doing a blood drive to help the community on November 28th. So the Community Blood Center will be down here. Please participate, please donate, and eat healthy, keep those immune systems going, and check out all our different retailers for really unique, wonderful face coverings. You can come down here and get them here.
Thank you. Jill, final thoughts, and thank you for the book, and thanks for the gift.
You're very welcome. Well, kids love to be empowered to do the right thing. And the right thing right now is to follow the pillars of infection control, as you talk about every morning. And when they do the right thing, adults lots of times will do the right thing too. So they can be the role model that we all need. Down at the City Market and anywhere they go, they use the pillars of infection control.
Thank you guys so much. Thanks for being on the program, and thanks to all of our guests out there who have been listening today. Hey, Monday, there is a disturbing trend in late-stage breast cancer surgery diagnosis directly related to the pandemic. That's been a result of a delay of care. We want to address that. Dr. Jamie Wagner, who is a breast surgery oncologist and the chief of breast surgery here, will be joining along with psychologist Dr. Elizabeth Monks. And they're going to talk with us on their view of this and what we can do to help improve that. Also, media, remember that there will be a news conference with the chief medical officers beginning at 10:20 this morning. The CMOs will be updating our elected officials from the entire metropolitan area, a large county swath of that, and then we'll be debriefing the media and taking questions after that. Listeners, take a watch this weekend because I think it's important information and gets back to what we say every day. It's the pillars of infection control. Mm-hmm. They follow you wherever you go. Hawk? Final thoughts?
Yeah, again, another weekend. It'll probably be chilly. People are probably going to want to get together, maybe watch the Chiefs. Again, as we talked about, it goes to individual behavior. And unfortunately, right now, we just can't do that. We can't meet in large gatherings. Remember to wear your masks. You know, if you think you're ill or are contact, get tested. But right now, it's a very dangerous time, and especially as we move into the weekend when people are trying to get together, just be smart because it's all based on you and your individual behaviors.
Yeah, a lot of sad cows out there.
Yeah.
And we do have to watch out for that. But remember, don't give in. Don't bring the danger to you. Keep the danger at bay. And you can do that by following the pillars of infection control. They do travel with you wherever you go, and there's still no place like home. We'll see you on Monday.